not all that much treatment. Then I reckon the main thing is that you go through.
Ambulance service, gloves and goggles, standard precautions. Are there any dangers that I can see?
No.
No worries. Hey mate, I'm from the ambulance service. I'm Tom, this is Nathan. What seems to be the problem today?
My breathing is just, I don't know, it's a bit weird.
We've elicited a response. Airway breathing circulation is assumed to be present enough. Have you seen any hemorrhaging on the patient anywhere around?
No.
Alright, so what was that? You got a bit short of breath today.
Yeah, I think so.
Has that just been today or has it been like this for a while?
The past couple of days.
And why do you think this is? Do you have any medical conditions? Have you been to the doctor recently?
Yeah, I do. I have to take a spray every now and then.
A spray?
Yeah.
Okay, do you know what it is?
I think it's called GTN.
GTN.
Yeah.
Okay, so do you have any cardiac related illnesses that you can tell me about?
Yeah, I had a heart attack a while ago.
Yep. How long ago was that?
10 years?
Okay, and you're feeling a bit of respiratory distress, breathing distress at the moment?
Yeah, I'd say so.
Do you have a box of medications for me, anything like that?
I do.
Alright, where's that?
It's right here. It
Oh, right.
has, inside is aspirin,
Aspirin,
atenolol,
atenolol, beta blocker, and
antonine,
that's GTN,
yeah, and vitamin B12.
vitamin B12. Is there any other medical conditions you want to tell me about?
Oh, probably.
Okay.
I can't remember them.
Can't remember anything wrong with your lungs? Have you been sick recently?
I can remember those for
Oh,
you.
thanks.
He has angina.
Yep.
He's had CA of the lung. He's in remission.
Okay.
Cancer of the lung.
Cancer of the lung, okay. So when were you diagnosed with cancer?
5 years ago?
Alright. What was your name, mate?
Callum.
Callum. Alright, what we're going to do, we're going to start doing some tests. Alright, I'm going to place this ECG on your chest, so your heart's working, and also see how other things are working. So, yeah, we'll get into it. If you could just place the dots on his chest, IO2 sats, also get a temp and a BSL, that would be great.
So temp is 37.5.
Alright. Callum, can you just get you to place your arm out like that? That'll be awesome. I'll take your pulse.
That's at 92.
Alright, respirate 28, heart rate of 84.
So his rest rate is 22.
22?
And his heart rate is about 100, 112, irregular.
Regular. Alright. Looks like a bit of atrial fibrillation.
Yep.
Callum,
Yeah.
when you went to your doctors last, did he tell you anything about atrial fibrillation, any other sort of heart conditions like that?
No, never
This is the
heard
first
of
time you heard about that?
it. Yeah.
Have you heard about a irregular heartbeat or anything like that?
No.
Okay, so this is new for you. So you feeling dizzy or anything at the moment?
Oh, not really.
Okay. Feeling nauseous, anything like that?
No.
Alright. Where is it? There, it's on my neck. Huh. Gonna take your blood pressure, Callum.
Mhm.
Have you ever taken before?
Yeah.
Yeah?
Yeah.
Do you know what your normal blood pressure is?
Oh, I wouldn't be able to tell you.
Okay. We'll just get you to relax your arm out. You can set up some oxygen. Just face mask at 8. Blood pressure is 110 on 80.
It's 165 on 90.
165 on 90?
Yep.
Okay.
Alrighty. Face mask at 8.
Yep, that'll be great. Alright, Cal, I'm going to get you to give me a cough for me. You able to cough? Okay. So just asking you again, Cal, haven't been feeling sick at all? Had a cough, anything like that?
Had a little bit of pain in my chest.
Bit of pain in your chest. When did that begin?
About 3 days ago.
3 days ago. What'd you rate that pain as? Sorry, well, I'll go into that a bit further. On a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain imaginable, how'd you rate that pain?
Well, I had some of my spray, so it's gone now.
It's gone and it comes and goes with the spray.
Yeah, I'd say so.
Would you say the spray's been successful using it?
Yeah,
Alright.
pretty successful.
I'll just get you to be quiet and breathe in and out of your mouth. Just normal breaths for me, please. You able to breathe in and out of your mouth? Thank you. Equal air entry all the way down to the bases.
So, you hear fine knuckles to the mid-zone.
Yep.
And a fine expiratory wheeze to the apex. And when he was saying before with his GTN, it has been successful, but he's had to use more today.
Had used more today than usual. Alright, Callum. There's a few observations that we're getting, they're a bit out of order. We will need to take a trip down to hospital. You're all good with that?
Yeah, I guess so.
Okay. Alright, well, I just got to ask you a few more questions. You said you just had chest pain before, and you've had this for about 3 days.
Yeah, it was 3 or 4
Can you
days.
describe this pain to me?
It's just sort of, I don't know, it's a bit everywhere throughout
Bit
my
everywhere?
chest.
You couldn't point your finger on it?
No.
Would you call it like a dull ache or a tight, stinging pain?
I don't know, it's like a bit of pressure, I'd say, maybe.
Bit of pressure? Okay.
Yeah, something like that.
Alright, and have you had any sort of, any other symptoms? You feeling anything else? If you could take that pain away, as I said before, sickness, any pain in the stomach, headaches?
No, it's just a bit hard to breathe.
Bit hard to breathe. Alright. So where you're sitting right now, is that okay? You okay sitting here? Is it most
Yeah,
comfortable?
Yeah, it feels
Leaning
better.
forward like that?
Yeah.
Alright. And you said the pain, what was the pain score we talked about before? What did you say it was?
Oh, well, I'm not really in any pain at the moment.
What? So you've taken the nitrolingual, your adenine, and it's gone away,
Is that the
essentially.
spray?
Yes.
Yeah. Yeah,
So-
I'm taking that.
No, you're feeling no pain at all at the moment?
Oh, not really.
Okay. Alright, so it's just a shortness of breath at the moment. So we've put that oxygen on, haven't we, Nathan?
Yeah, we haven't seen a change in this.
Haven't seen any change in stats?
Sorry. Change that.
Do you have any allergies?
Yeah, I do.
What do you have?
I'm allergic to penicillin.
And what happens when you have penicillin?
Oh, I get a bit of a rash and it makes it a bit hard to breathe.
Okay. Have you been eating and drinking recently okay?
Yeah.
Having normal bowel movements, all that sort of stuff, urinating?
Yeah, seems pretty normal.
Okay, so basically, in summary, you've called us because of a shortness of breath, and you've had a bit of chest pain in the last couple of days.
Yeah.
So what's concerning you the most at the moment? Your shortness of breath?
Yeah, definitely.
Okay. So have you had any, what we'd call a heart attack recently ever in your life?
Well, not recently. I said I had one about 10 years ago.
Oh, you did?
Yeah.
Okay, and nothing else, you've had nothing happen in between then with your heart?
No, not really.
Okay. With this shortness of breath, did this happen recently? Does this happen a lot?
No, not really. Not that I can think
So
of.
this is the first time you've had a shortness of breath like this?
Yeah, yeah, I'd say
You
so.
have to sleep up. You have to, when you're sleeping at night, you have to sleep upright usually.
Just over the past 3 days.
Just over the past 3 days. So it's getting worse and worse. All right. What I might get you to do, Nathan, is probably set up a wheelchair, and we'll get him into the van. As far as your shortness of breath goes, I didn't hear any wheezes or anything like that.
So you did hear a fine wheeze to
Is that an inspiration or expiration?
Expiration.
Okay.
You also have crackles to the mid-zone.
Crackles to the mid-zone. Did we get a temp? Just grab me another temp if you could.
So it was 37.5.
37.5. I'm pretty happy with that. Alright. With that wheeze, I reckon we might give him a little bit of salbutamol.
Yep.
Yeah, let's set that up. Give it a spacer. So we'll put it through the asthma mask.
Yep.
If you could set that up, that would be awesome. Ah, it's in the nebulizer. Yeah. Do you have anyone we can call? Tell them you're here by yourself at home?
Oh no, I don't have any family.
Alright. Just going to ask you a few silly questions before we get into the truck.
Alright.
Alright. Do you know what day it is today?
Thursday.
Do you know what month it is?
September?
September. Okay. Do you know the year?
2014?
Okay. And do you know what's happening at the moment? You're all aware
Yeah, you guys are here.
because of your shortness of breath?
Yeah.
Alright. If you get you up, reach up and squeeze my fingers like that. It's awesome. Alright, so a little bit confused. GCS 14. So what we're going to do, we're going to probably set up some salbutamol. Probably something we could do in the truck. So we get him loaded and get him to hospital.
Sure, okay. No worries. Do you want to stop there?
Yeah.